Just got this email from my producer, Amy. We're getting ready to go shoot over at Children's Healthcare with Dr. Marshall, and it says something about SLJ. As far as I know, that stands for Standard Long John. So I'm not sure what Dr. Marshall's going to tell us about long underwear, but stay tuned to Clubhouse Gas and find out for yourself. We're honored once again to be joined by friend of the show and director of sports medicine here at Children's Healthcare of Atlanta, David Marshall. David, thank you so much for joining us.
Thanks for having me.
Who's this good-looking young man you've got with us here?
This is my son Grant. He's a third grader at Wesleyan School, and he's going to be helping us out with some of the anatomy of these growth plate injuries.
Good. So at least there's somebody here who's smarter and better looking than the two of us.
It's not you and I.
So we're talking about SLJ today, and I have no idea what SLJ is. I've read it, but I can't pronounce it. So could you please fill me in?
Yeah, SLJ stands for Sinding-Larsen-Johansson syndrome, and it's a condition that affects the growth plates of young athletes between the ages of 7 and 12. So really before they reach those pubertal or adolescent ages, and it's an injury that involves an injury to the growth plate because a muscle or a tendon pulls on that growth plate, and that seems to be the weak link, which causes the pain.
All right. So where does that exist? On this young man.
Grant, you can see I drew a couple pictures on him. The first larger circle, that's the kneecap, what we call the patella. And if you think of the patella or the kneecap as kind of shaped like an egg or a football, it's the bottom pole or the inferior pole of the kneecap, or the patella we call that, and there's a growth plate there. And that growth plate is a big block of cartilage that serves as the anchor point for the thigh muscles. The largest and strongest muscle he has in his body is the quadriceps, and those quadricep muscles attach right to that area. Straighten your leg and bend it like 4 or 5 times all the way up. So you can see as those quadricep muscles pull, it has to pull on the bottom of that kneecap, and that sets up a traction type force. Very similar to a cable attached to a screw, screwed into a plaster wall. If you keep pulling on that very thick, powerful, tight cable, something has to give. And what gives is the screw starts to come out of the wall a little bit, or little tiny microscopic cracks in that cartilage, and that's exactly what causes the pain here.
All right. Well, Grant, we're going to let you go do your math homework so me and your dad can talk a little more. We won't make you sit here for the rest of this. So we know what SLJ is. What are the symptoms?
Basically, it's pain. They get pain right at the bottom pole of that kneecap, and it'll usually occur after workouts. The kids will come back from a game, from a workout, or just playing outside in the yard with their friends, and they'll come in and they'll complain of pain in the front of their knee.
Is that the main cause, or is this another one of those overuse injuries?
This is one of those overuse injuries, just like anytime there's a muscle or a tendon that attaches to one of those cartilage weak growth plates, and they play a sport or do an activity that uses that tendon a lot, that growth plate is the thing that fails. If it starts to break apart a little bit, it's kind of more of an advanced condition, then they might get a little bit of swelling. So pain and swelling in that area are really the two key points in diagnosing this.
So my kid gets the pain in the front of his knee. I bring him in. You diagnose him with this syndrome. How do you treat it?
Well, the treatment for overuse injuries, number one, is to underuse it. So you try to identify the activity or the part of that activity that really causes the discomfort. Maybe really back off on the running, the sprinting, the jumping. Some of these younger kids are starting to do speed and agility training where they're doing ladder drills, or they might be doing weightlifting for the quadriceps, such as squats, power cleans, lunges. All those things are avoidable, should be cut out of their workout. Second thing they need to do is ice it. I think ice is a real nice anti-inflammatory treatment. The best anti-inflammatory treatment is to avoid the inflammatory activity that we just talked about. The second thing is ice, and I like to have kids do what's called ice cup massage. Simply get a styrofoam coffee cups like this, fill it to the very tippy top with water, and maybe put 3 of them in the freezer. So that way they're always there. And as soon as they come in from a workout and they're sore, before dinner, before homework, sorry moms, but before all that's done, go right to the freezer, take one of these cups out, and you can peel back an inch of the paper around the rim of the cup. Then they have a nice little frozen snow cone, like a push-up pop that we used to enjoy. It's insulated so your fingers don't freeze, and just do some circular massage right over that sore spot for 8 to 10 minutes. When it goes numb, you can stop. Wait an hour to 90 minutes after homework, after dinner, when you're watching the Braves on TV, get that cup out again and ice it for another 8 minutes before bedtime. That can be a very effective anti-inflammatory treatment.
The most important question, according to some of our posters, is can he pitch? Can he play linebacker? If your kid gets diagnosed with SLJ, can he go, or is this going to be one of those things that puts him on the shelf?
Yeah, that's not always an easy question to answer, because some of these growth-related injuries, it's okay to play with a little bit of discomfort and endure the pain, as long as they're modifying their workouts, they're using ice cup massage, they're using anti-inflammatory medicine like Aleve or Advil or Motrin. As long as we can keep the pain level down to a minimum, then some of these injuries, it's okay to return to play. We've talked about Little League elbow in the past, and the answer is no. They really should not play with any discomfort, or they shouldn't pitch or throw with any discomfort in the elbow, because the risk of having that growth plate completely separate are too great. Down here in the knee, we're talking about Sinding, Larson, or Hansen. With that one, the risk of having a complete separation is much less, to where I think it's okay to play as long as the pain is decreasing and is under control.
All right, well, thank you so much,
Yes,
Dr.
sir.
Marshall. We really appreciate it.
Thank you.
We'd love to have you back, and we will have you back. Dr. Marshall's going to join us next Tuesday, and we'll see you right back here then for another great edition of Clubhouse Gas.